Now we're at that place in the agenda where we have mixed things up a little bit by allowing you to volunteer yourselves to become one of our panelists. It's clear that a robust innovation ecosystem is one populated by innovative people and organizations, and they are the ones who are transforming ideas and discoveries into new products, services, and delivery models. Our next panelists represent successful entrepreneurs and businesses across the state who are supporting this system, including Marie Hopper, who joined our panel no more than 30 minutes ago. So much for being overly prepared. We have already uploaded her bio and photo into the app, so you can click on the session and agenda to learn more about her. All of our panelists today are here to answer a single question, which is, what are successful innovators doing to pay it forward for the next generation of innovators and entrepreneurs? I'm really pleased that here to help us moderate this conversation this morning is the Chief Operating Officer for the Greensboro Partnership. In this role, she leads the partnership's Entrepreneurial Connection Business Unit, as well as the Chamber of Commerce, which she joined in 2011 as its president. She has also proven herself to be quite the sport by allowing us to crash her panel with an open seat. Please welcome to the stage, Deborah Hooper.
Well, thank you, Anita, and thank you for allowing me to participate in this wonderful forum and this exciting panel today. If there's one thing that we do know about being innovative, it's that we need to be willing to take risk, right? So I'm going to go off script for just a moment and tell you about a risk that we're taking in Greensboro that really connects the topics that we've talked about this morning, where talent development, higher education, and just the panel that just talked about place, we call it CoLab. And yes, CoLab, the name originated from the word collaboration. CoLab is our new downtown Greensboro entrepreneurial hub, co-working, and higher education experiential learning space. We opened it last November, and what I really want to share is that CoLab is differentiated from other co-working and entrepreneurial hubs by the fact that it is a student experiential learning space. We have almost 50,000 college students in Greensboro at our 7 colleges and universities. And CoLab offers our students free memberships and really focuses on engaging them in business and university collaborations. We really want to help provide them some real-world experiences as well as an incentive, we hope, to stay in Greensboro after graduation. So we think CoLab is a risk worth taking and is our way of paying it forward for the next generation of innovators and entrepreneurs. So since yesterday morning, we have heard a lot about what companies and communities across North Carolina must do to innovate and compete, especially as it relates to workforce and talent development, higher education, financing, civic engagement, and place. And a lot of the conversation has focused on what others must do. Our panel is going to highlight some significant efforts being led by these innovators themselves to build and support the ecosystem. So on our panel today, it's my pleasure to introduce them. 7-time successful serial entrepreneur, writer, advisor, and the Triangle's most active and engaged angel investor with 17 local companies in his current portfolio, David Gardner. An award-winning designer, inventor, and serial entrepreneur, our next panelist has pioneered, patented, and created lucrative new markets in active learning and audio steganography, the art and science of hiding data in an audio file. Joining North Carolina State University in 2014 as a Chancellor's Faculty Excellence Program Cluster Hire in Innovation and Design, please welcome Christian Holges. President of Mosaic Health Solutions, a Durham-based subsidiary of Blue Cross Blue Shield of North Carolina, our next panelist recently completed a 4-year term on the board of the Council for Affordable Quality Healthcare in Washington, D.C., and currently serves on the advisory board of the Oliver Wyman Healthcare Innovation Center. She's also the Executive Vice President of Diversified Businesses for Blue Cross Blue Shield of North Carolina. Please welcome Maureen O'Connor. And rounding out our panel, our special surprise panelist is the innovator from our audience, and her name is Marie Hopper. She is the Executive Director for the North Carolina First Robotics. So, Marie, welcome to our panel. Thank you for having the courage to put your name in the hat. I would share that her bio has been added to the app for you to access and learn more about Marie, and we're going to hear from her throughout the discussion. So David, let me start with you. You're a very successful serial entrepreneur who's traversed this innovation pipeline many, many times, and you're now focused on providing support for other entrepreneurs. This past November, you made the front cover of the Triad Business Journal with the caption, "Angel of Optimism." Today, in a world where investors are less reluctant to fund a venture unless an entrepreneur has a couple of companies under their belt, shall we say, you've chosen to help fill this gap by really supporting these new emerging entrepreneurs. Why are you taking on this risk?
But Deborah, I don't consider what I do really super high risk. People laugh when I say that early stage investing in North Carolina is actually the lower risk end of my portfolio. I really get to know these companies. I mentor them, talk to them, work with them, watch how they execute over time, and making an investment in them is almost like an afterthought. I didn't think of this as an investment model. I was just trying to help early stage entrepreneurs. But I began to notice that some of them could really execute on what we talked about, and some did not. And sure enough, they were the ones who became successful. So I kind of backed into this. For me, early stage investing here is kind of like legal insider trading. I get to know, the team and what we're doing and see the traction that they're getting long before I write that check. Okay.
So do you think we're going to see others be more willing to follow your example?
I hope so. I think early stage investing, especially in this area, should be a part of everyone's portfolio. It's interesting to note that the startup valuations in North Carolina are about 1/4 of what they are in Silicon Valley. So right off the bat, so a startup company costs, 75% less here than it does in the Valley. So you're starting off with $4 to 1 as you start making these investments. And North Carolina, as far as the sheer number of early stage entrepreneurs wanting to start companies, it's a very target-rich environment with very minimal other capital available to them. So I think that, my companies have done well, all 17 of them. Even though they were early stage, they've raised millions of dollars in venture capital beyond my investment. Several of them are worth, 15 to 25 times what I paid for those companies even a year ago. So yeah, I think it's a great part of anyone's investment strategy. Okay.
How do you think that your effort builds on the type of funding that we heard about this morning?
I like everything we talked about today. The importance of STEM education, I think, builds on that. Having coding schools, having wonderful things like the Durham Underground and the Triangle Startup Factory, I think all of that's important. The key missing component here is early stage seed dollars. I meet with a lot of entrepreneurs who just don't have, they've got a great idea, and you can tell that they're winners, they're going to be successful, but my funds only go so far. Okay. And so that's what I think is really missing in that equation.
Okay, thank you. Christian, you're also a very successful serial entrepreneur who recently relocated to Raleigh from Silicon Valley and have joined the faculty here at NC State. So while you came to teach this next generation of innovators, you've also begun a journey to connect some of our institutions of higher education in providing venture support for the commercialization of spinoffs. So could you tell us what motivated you to come to NC State and your vision for this higher education partnership?
So shameless plug, one of the reasons I'm back is to be near my entrepreneurial children. They are the band Delta Ray. So I get to be near my children, and that brings me great joy. My wife's an entrepreneur. She started Mother Reed here in the Triangle Park years ago and has gotten a Medal of Honor at the White House. And I'm sort of late to the game, but I've created products that have made hundreds of millions of dollars, and I'm not bragging because I think I'm not the best inventor in this room, right? Everybody, if we're not taking a stab at innovation, you ought to give it a try. It's a lot of fun, and the power of this triangle is right here. It's all of us doing this heavy lift. And I went to Duke University, and then I came over to NC State. And back then, 30 years ago, I tried to mix it up a little bit, and we didn't get traction. We have to get traction. There can be no Duke, UNC, NC State without us being entwined. There can't be a Durham and a Raleigh and a Chapel Hill without us being entwined. People want to know how to make the Silicon Valley happen here, and Bob Jolis is right. We're going to grow something different. It's not going to look like the Silicon Valley, but we've got to get out of our own respective silos, if you will. The position I've taken, thanks to Chancellor Woodson, is an attempt to stir it up at NC State. But we can't just stir it up at NC State. We've got to stir it up at Duke. We've got to stir it up at UNC, and we've all got to pull together and do the heavy lift to create a community that's rich for inventors and creative types. And in building this rainforest, or trying to create this rainforest, we need water. And I'm working with the Cornerstone Group, and the Chancellor's been very helpful in facilitating venture capital, whether it's the Cornerstone Group that wants to talk to Randy and NC State or UNC and Duke to try to facilitate cash flow between Charlotte, and I didn't know this, but apparently, you know, Charlotte and Raleigh don't have the best relationships, so there's some things to be smoothed out there, and we need to work on that. But here we've got the second largest banking center in the country in Charlotte, and that means there's some money there. It's not all VC, but we should be working with them closely, and so there are ecosystems that we're working at NC State to facilitate. Duke's been over to talk about a new angel fund group that they're trying to foster at both UNC. So we're looking at a much bigger ecosystem than just at NC State.
Okay, so how does your vision for an innovative place extend beyond, I'll just call it the Research Triangle Park area, to other parts of North Carolina?
So I just spoke to one of them, right? We've got money in Charlotte. We've got great research and development in the Research Triangle Park. I'm also at the College of Design. The biggest technology company, nay, the biggest company on planet Earth, bar none, is founded on design. So we hear a lot about STEM, and I'm a STEM kind of guy. But design is the cornerstone, I think, that we really ought to be looking at more thoroughly as a part of that conversation. So I'd like to see more of the Apple model implemented, and actually that is the cluster. It's the good design thinking coupled with good business thinking, and we're trying to leverage that and take advantage of money in Charlotte, but also there's an old relationship up in Nashville, right? Black Mountain College drew the Bauhaus geniuses from Germany. When Nazi Germany closed down the Bauhaus for fear of all the creativity, a lot of those very smart people ended up at Black Mountain College, and Asheville owns a lot of that, UNC Asheville owns a lot of that content. We're trying to rekindle the corridor with UNC Asheville and a lot of the creativity that's going on up there at the Collider and other good folks there. So Charlotte we're trying to conjoin with, Asheville we're trying to conjoin with, and leverage this rich, fertile area, the Research Triangle Park, Duke, Raleigh.
Okay. We're going to talk more about how you can also hit the center of the state and the Triad area, too. So, Maureen, last summer, Blue Cross Blue Shield of North Carolina started Mosaic Health Solutions to drive innovation and to invest in companies that are going to make healthcare better for consumers. So, as I understand it, you're looking to invest in new health solutions that are going to simplify and expand access to care. You're going to pioneer collaborative healthcare approaches and also deliver better value to the ultimate consumer. So we might do the math and think, okay, so people are going to be healthier, and they might not need as much health care. Eventually, that might cause insurance rates to go down. So, you know, this seems maybe a little counterintuitive. So why would Blue Cross want to essentially compete with themselves?
Well, really, if we could make people healthier, which Blue Cross has been about forever, trying to moderate that cost trend that we all are feeling in healthcare. That would be goodness, right? That really would be a win-win, because what we'd be able to do is then moderate the rising cost of premiums, and more North Carolinians would be able to afford coverage. So it really isn't a paradox. It really makes a whole lot of sense why we're looking for various channels, various ways of trying to drive innovation and improve the healthcare system. I could spend a lot of time talking about what Blue Cross is doing in this regard, whether it's launching a new transparency tool, which we launched 3 weeks ago, and it's gotten a lot of national press. Why? Well, because it's a tool that gives people, consumers, the ability to actually understand what care costs. And it's remarkable when you think of all the other segments of our life. That's just assumed, right? You don't buy anything without knowing what it costs. But in healthcare, it's been a lot more of a mystery. So Blue Cross has been doing a lot, using retail stores to enroll and service customers. Really important partnerships all over the state with healthcare systems to really help redesign the way care looks and feels. But you asked me about Mosaic, so I'm going to try to talk just for a moment about Mosaic. We also are trying to make the healthcare system better. We're trying to do it by putting the consumer at the center, because we believe healthcare is going to catch up to the rest of the world and become a consumer-centric sector. But we're doing it, again, in a different way, which is investing in companies, even potentially building companies that really can transform healthcare. Our hope is that will happen by reducing cost. It will happen by making the system simpler, which we all need, and ultimately really improving the value. So I don't have time to go through every investment we've made, but since July, we've made 4. Mosaic Health Solutions has 7 companies in our portfolio. And maybe just to give you a taste of a couple of them, but I would encourage anyone that's interested to go to mosaichealthsolutions.com and check it out. So one is a Durham-based company, a very early stage company called TouchCare, and they have developed a mobile app that will connect patients and their own providers to do virtual visits through smartphones or tablets. It's simple, it's elegant, it is secure, given all the issues we've had with security. That's really important. But again, we think it could transform the way we're all interacting with our physicians, not for all care, certainly, but for a lot of routine care. It's a great way to have an encounter. Another company that we've invested in is called LifeNexus. They've developed a product called iChip, and it's basically if you think of a credit card, in fact, all the financial services industry has moved to chip technology. This is a chip on a card that contains personal health information of the consumer. So it belongs to the consumer, and they're able to present that card at the point of care in meeting with their physician, let's say. And what that card contains is all sorts of demographic and sort of health history, but also every encounter that patient has had in the healthcare system broadly. So think about the clipboard. Think about the frustration that we all have when we go in and see the doctor. That will go away with this technology. And it really will empower the consumer to have a very, very different kind of conversation, because they will have more information. Okay. So just a couple of quick examples.
Thank you so much.
Sure.
Marie, thank you so much for joining our panel. You shared your name for consideration by putting your name in the hat, because you represent a slightly different story from the rest of the panelists. Could you take 1 to 2 minutes to tell us your story at this time?
Sure. Thank you so much for allowing me this opportunity. I'm the executive director of NC First Robotics, and we are a nonprofit that offers K-12 programs as a way to get students inspired to go into engineering and to become innovators and entrepreneurs and the next leaders. And I think the voice that I represent is that K-12 pipeline. Here in North Carolina, We were very, very far behind our fellow states in 2009, and we only had about 200 students across the state even engaged in doing anything remotely related to robotics. This year, at the high school level, we have over 1,500 students involved. More importantly, of those 1,500 students, 63% of them come from underrepresented populations. They are girls, they are African Americans, they are Hispanics, they are students that come from poverty. So we have teams ranging from Bertie County all the way to Hendersonville and everywhere in between. And as part of our program, they are forming small companies within their high school to create these high school robotics teams. And as a small company, they can compete for entrepreneurship awards, as well as awards about how well their robot is built, and going into marketing awards, everything that they need to do to run their small company to be able to build a robot in only 6 weeks for competition. So I think we represent that pipeline that if we don't get that creative, entrepreneurial, innovative thinking at a very young age, then they won't go to the higher institutions of education, and they won't create those businesses. So we're starting them young.
Perfect. And it is a great way to engage students early on so that they stay engaged and can complete their education as well. Yesterday, during the Innovation in North Carolina, Then, Now, and Next session, panelists were asked to respond to some predictions of the future. And I'd like to ask each of you to comment on a prediction that I heard about recently. Eventually, computers will replace 80% of what doctors do and amplify their capabilities. Marie, I'm going to start with you. Do you agree or disagree?
I agree, and I think that the computers are going to allow us to unleash more creativity and more opportunities for us to conquer more of the really serious, deadly diseases, that they become a tool that, in fact, do make us smarter, do make us more capable, and do help us to achieve more.
Okay. Maureen.
Yeah, I also agree. I don't think, I want to be clear, that computers will replace 80% of doctors. I do think that we're all going to live longer, and we're not a particularly healthy bunch, so I don't think physicians need to worry about job security. But I do think computers, predictive analytics, robotics are all going to significantly change the way physicians are practicing and are going to allow them, there's a phrase that we use in healthcare, that we really want healthcare providers, whether nurses, mid-levels, physicians, operating at the top of their license. I think this really is going to empower physicians to operate at the top of their license.
Okay. Christian?
I absolutely do. We're going to have the good fortune to listen to Ray Kurzweil, I think later today. He's written several books on singularity, and if you haven't seen the movie Transcendent Man, a documentary, it's a stunning piece to watch, because we're replacing our body little by machine, and the idea of we have cars that have driven millions of miles on roads, and to think that a machine couldn't go in and do a procedure on the human body is, I think it's a natural next step.
Okay, and David, what do you think about this?
I'm definitely not a doctor, but I do think that machines are going to extend the reach. I'm excited about plans that I see in the telemedicine space. The tools, especially wearable devices. A couple of my companies are in healthcare medical devices that you wear. Historically, most of our information about disease management and things have come from claims data, which is really after the fact. Those wearable devices give providers real-time information so they can get ahead and do an intervention before we have claims data.
Okay. All right, well, we have several questions from the audience. In fact, Christian, I think you hit on something talking about how you're going to work across the state of North Carolina, where your vision is concerned with higher education. Could you talk a little bit more about how we can encourage more diversity and engagement across the state of North Carolina with all of our colleges and universities?
Right, so I may step on toes here, but I'm not coming from the university system, and so higher education, I even have a problem with the turn of phrase, right? So we don't know if this isn't like gas chromatograph where you put the elements down here and they migrate at their will in the environment, right? So we may find that higher education is reaching a 12-year-old at home because they're focused like a laser. So I think we really need to focus on, and somebody spoke to it yesterday about the taxonomy and some of the infrastructure, the frameworks that we're working with are kind of holding us back. So I'm dreaming of new frameworks, and I'm finding that there's latitude and big thinkers within the university systems. If we're not willing to eat our young, somebody else will, so we better be looking at whole new ways of doing this. So I can see new education systems that dovetail with new innovation systems, and we heard it yesterday, you know, open formats where people are putting their innovation online for free will lead, I think, to foster more innovation.
Okay.
Just as a quick aside, it was spoken, somebody put up a thing that said that, you know, instead of the flying car, we got 154 awards. What 154 awards got us was citizen reporters in areas that we couldn't send CNN, right? So I think more than a flying car, it dented the universe. 154 awards matter.
Okay. Well, as we wrap up, I'm going to ask this last question. So think about the key innovators that influenced and supported each of you. How has that shaped your desire to give back to the next generation of innovators? So David, I'll start with you.
Well, a number of people, back when I was coming along, today, you know, there's only one thing I've heard that I kind of disagree with today, and that's that we don't have enough entrepreneurs in North Carolina. I find that we have a plethora of entrepreneurs. I get 8 business plans a day. I speak to a class like at NC State last week, and for 2 hours, students lined up to talk to me, and then I got 38 meeting requests afterwards. We have incubators and accelerators and think houses. We're doing a good job. It's cool to be an entrepreneur. When I was coming along, if you told your parents you wanted to be an entrepreneur, it's like saying you want to be a rock star. You know, put it out of your mind, go work for IBM. But today, we're doing a great job of encouraging people to be entrepreneurs. What we're doing a really bad job of is giving them seed capital. We have a lot of great entrepreneurs that you've never heard of because they never got a couple $100,000 to start their company. And so if that is, I think, the missing link in the chain today is that step. So I think that having mentors, we have a lot of people. Blue Cross Blue Shield invested in one of my ventures 10 years ago, and the CEO was on my board and opened doors for me, and it was fantastic. But I got lucky. A lot of great entrepreneurs don't get that lucky break, and without the seed round capital there to get them started, that's the piece. Without that link of the chain, the whole thing falls apart.
All right. Christian, quickly.
Just quickly, my dad used to ask me, Crick, you know who the fastest man in the world is? And I'd say, no, who, Daddy? He'd say, we don't know. He never ran. And there's a thought for you, right? So my inventions have done very well, but I know I'm not the best inventor in this room. So if you have an idea, please pursue it. If you're thinking whether, you know, pick up the phone, call me. We've got people here to help you facilitate the idea. But the fastest man in the world, you may never put on your shoes and give it a run. Or fastest lady, please give it a shot. We're here to help.
All right, thank you. Maureen.
Yeah, I'll take a slightly different angle on this because I think both David and Christian have made great points. Larger organizations, some of whom are represented in this room, whether it's government agencies or large, well-established companies, you can help foster this environment really by allowing some of these companies that have great ideas to be the sort of fertile for pilots. That can sometimes be hard because you've got your work plan for the year and it can seem like a distraction, but I think it's really, really important. One thing that Blue Cross has done over the last couple of years is really foster innovation within the company. And that's a very, it's not necessarily what's happening in American tobacco, but it's equally as important in that, trying to really create a culture of innovation. We do innovation challenges. We've developed an innovation lab. And it's not one department in the company. It's the whole workforce. So I would really encourage everyone that's with a larger organization to think about it in your own context.
Thank you. Marie.
I would encourage everybody sitting here today to go mentor somebody in the K-12 sector. Help those students see someone who looks like themselves so that they know how they can dream and how they can go on to become our next generation of innovators and entrepreneurs.
Thank you. Well said. Well, thank you all very much for joining us today and for sharing your insights on innovation and for what you're doing to support innovation across the state of North Carolina. Anita, I'll turn it back to you.